My name is Michael Rozier. I'm a faculty member in the Department of Health Management and Policy at St. Louis University. I also serve on the board of directors of a health system here in St. Louis. So my world is thinking about healthcare, health policy, health administration. I had the privilege of serving as an ethical geo fellow for the American Geographical Society a couple years ago. And the reason I was intrigued to do something like that was because I've been thinking a lot about how the collection of personal location data, our proximity to each other, our proximity to health delivery and care organizations, our proximity to risk factors or protective factors of our health is actually shaping our ability to analyze and predict our health behaviors and our health status in a way that might require us to reconceptualize what we mean by protected health information. I'm going to talk a little bit about some of the questions that are emerging for us in the healthcare space that are largely driven by these new realities around personal location data, and excited about the conversation. So let's just start with an acknowledgement that health is a deeply personal reality. And we can think about health at the individual level or family or group or the entire population or community level. But if we just think about it briefly at the individual level, think about how deeply personal whether you have a particular condition. It might be a condition that has some stigma related to it, whether it be some kind of mental health issue or HIV/AIDS, or it could be something that doesn't actually have any kind of stigma associated with it publicly, but you still don't necessarily want that information disclosed, whether it be diabetes or cardiovascular disease. Also, our health behaviors, whether we exercise or what kind of food that we eat, or whether we have, the adequate housing. All of those things have implications for our health, and they're deeply personal in nature, and that happens at the family level as well. So whether our family unit has a particular genetic predisposition for something, or that we have conditions that are similar across family units. And then at the population level, we think about our communities, whether a community is exposed to a particular risk factor, some kind of carcinogen that might be in the air or the water or the soil, or whether violence is common in a particular neighborhood. All of these things speak not only to kind of some external reality, our health status, our health behavior, but it speaks to something deeply about ourselves. And that is why any kind of implication for disclosing health behavior or health status has been protected by law. And since 1996, we have had the Health Information Portability and Accountability Act, HIPAA, which probably was not part of most people's language until COVID, but then suddenly, because of the pandemic, everybody was talking about HIPAA. Most people were talking about it incorrectly, but people were at least talking about it, acknowledging the fact that in the mid-90s, we recognized how private and personal health information was. So we put up a pretty robust legal infrastructure, regulatory infrastructure to protect our health information. Now, what's unique about HIPAA is that it actually applies to a very small set of organizations. So it applies to our health plans, and that could be government-run plans, or it could be private insurance companies. It applies to our health providers, whether that be an urgent care clinic or a hospital or some kind of outpatient rehab center that we go to. It also applies to the business associates that often transfer data and exchange data, do analytics with that information that is generated largely by health plans and health providers. And it also applies to hybrid entities. Like I'm at St. Louis University, and we have a student health and counseling center. And so part of the university, the educational part, isn't regulated by HIPAA, but the student health and counseling part of it absolutely is regulated by HIPAA. Now, so what does this say? I, as an individual citizen, you as an individual citizen, aren't regulated by HIPAA because you aren't one of these four what are called covered entities. So if you disclose somebody's personal health information, unless you've gotten it as an employee of a health system or a health plan, but if you just heard somebody talking about somebody who has cancer and you talked about it to somebody else, that's not a HIPAA violation. So HIPAA only covers these entities, and that matters for what I'm going to talk about in just a moment in terms of our personal location and how it's gathered and what that means for health privacy moving forward. And so if we think about this as our current context for protected health information and the legal infrastructure that protects our health information and everyone else's from being disclosed, that's why this new reality of generating tons of data around personal location and health opens up brand new questions for us in the healthcare space, especially around this protected health information, because we are generating tons of health data. A lot of people are using smartphones or smartwatches that are monitoring sleeping and heart rate and oxygenation, all kinds of other things, and it's gathering that health information, but it's also gathering where that is occurring. So the routes that you run, or where you are sleeping at night, or anything related to that. We also have health usage based on geolocation. So hospitals are getting much better at tracking where we live and what the risk factors associated with our particular living situation is. And I'm going to in a moment talk about why that is so important. Health behaviors or risk factors from geolocation. So I talked about, what if we grew up in a county that we didn't, when we lived there, we've subsequently moved, when we lived there, we were exposed to something in the air, water, or soil that is now showing pockets of cancer emerging. We're not associated with that geography anymore, but we can actually track the likelihood of people developing disease even after they're no longer in a particular geography. Another way that this is kind of come to be is related to COVID and the way that we were able to track how close were you to pockets of outbreaks and how does that increase your risk of acquiring or transmitting the disease. And then there's also a lot of information that we're gathering kind of in the Internet of Things, our use of various devices in our homes, our use of our automobiles, again, that have some geography-related, location-related implications, and right now, very much related to how we can predict your health behaviors and health status. And so, again, I talked about hospitals collecting our location data, kind of where we live after we're discharged from a hospital, or where we're likely to be readmitted from, and that's because, in the large scheme of things, at the population level, our zip code is a better predictor of our health than our genetic code, which surprises people. But if we looked at the population level, what actually contributes to our health status? 40% of it is socioeconomic factors, the education we received, the employment that we or our family have, the income, the safety of our neighborhoods, or the physical environment, the housing stock in which we live, whether there's a park next door to where we live or work. 30% is related to health behaviors, and only 20% is related to health care itself. So the treatment that we get at the urgent care or the clinic or the ambulatory care center. And so if we think about the implications for this, geography, where we live, work, play, that is the driving factor of our health status. And so if there are organizations that are interested in our likelihood of getting diabetes, or whether we have diabetes right now, our likelihood of having some kind of mental health condition, our likelihood of having cardiovascular disease, and there are plenty of organizations that are interested in our likelihood of currently having or in the future having this, actually geography is more important to them than our genetics or the healthcare that we have received. In the bottom right here, we have a map of one of the metro areas, Minneapolis, St. Paul, place that I had the privilege of living in for 2 years. And we can see just along the interstate, the difference in life expectancy as we travel through the interstate. And you can map this out for any metro area in the country, and you will see disparities of 15 or 20 years within a couple miles. And that's because the neighborhoods, which largely drive the quality of school district and education that people received, the type of employment that's available, the ability to recreate safely, all of these things are geographically determined by and large in this country, and therefore have major implications for health status and broader life expectancy. So what can location, I've mentioned a couple of things before. COVID really put this into full relief for a lot of us, both in the United States and internationally. A lot of places, especially in East and Southeast Asia, use these location tracking to predict whether, or to determine whether you were exposed to COVID and to predict whether you are likely to have it and transmit it to others. So that's kind of, I think, in the public imagination a whole lot right now. But we can also use people's daily travel to determine what is the likelihood of you going to, or how often have you visited a substance abuse treatment center, or are you going to a cancer treatment center on a regular basis? So those are kind of very obvious ways of determining whether you are likely to have a particular condition or not. But again, based on your geography, based on where you work, where you live, where you recreate, we are now getting very good about using those kind of location data to predict the likelihood of your health status. Again, poverty is one of the strongest predictors of health overall. So if we can determine pockets of poverty, or what's called the social deprivation index, that allows people to use this data. And again, in that upper right-hand corner, for very personal purposes. So some colleagues and I fielded a study through the support of the Ethical Geo program. And it was a national survey, over 800 respondents to this survey across all geographies. And we asked a couple core questions. Do people know when their location is being tracked? What locations do people consider to be most private? And how do people balance the benefits and costs? Because there are tremendous benefits as well from having our location known, and even from having outside entities know our location. That there are personal, economic, a whole lot of other benefits. So we wanted to know, like, how are we attempting to balance the costs and benefits? Because we don't want to pretend as if there's only risk associated with disclosing of health information and no benefits associated with it. So the journal Value in Health published the paper that you see right here. So again, the responses to some of these questions: how private do you consider your personal location to be? The extremes, the very private and not private at all, were the smallest percentage of respondents. Somewhat private and private constituted the majority of respondents there. We asked the question only for those people who have smart devices, smartwatches and smartphones, which was well over 80% of the respondents. Do you have apps that track your location? Now, of course, we know that almost every device imaginable has apps, and almost all of those apps track our location to some degree or another. And so presumably this would be a much higher response than 71% if there was perfect knowledge of knowing whether your apps track your location. But there's a pretty sizable group that either don't have apps that track location, which is probably pretty unlikely, or they just don't know it. And have they ever turned off the location of their tracking app? Even an even smaller percentage have never turned off the tracking of their location within an app itself. By and large, this was similar across demographic realities. The older a respondent was, the less likely they were to have knowledge of location tracking or a history of location management. And our female respondents were also slightly less likely to have knowledge of location tracking. Otherwise, income, education level, race and ethnicity, and any other predictors. We collected political ideology and a lot of other demographic realities were not predictive of whether people knew that they had abstracting the location or managed it in some way. Now, we also asked them, we gave them this kind of map, and we asked them to identify the 3 areas or the 3 locations that they determined were a highest priority to conceal. And you see the percentage here of respondents who selected a particular location as one of the top 3 locations on the map. You can tell that substance abuse treatment centers, hospitals, and medical marijuana businesses were the 3 most likely, but a lot of them were health related. And again, so I think this speaks to the reality that health has a special place in our sense of privacy. And so as we think about the way that location data is being used to predict at the individual and population level our health behaviors and health status, I think we can't think about it in relation to maybe other outcomes of interest, whether it be kind of our purchasing behavior or driving safety or that kind of stuff, because again, it speaks to something that is deeply personal. But here, I think it just kind of illustrates, especially those places that might have some kind of stigma associated with it, like a substance abuse treatment center. I wish that we were in a world in which there was no stigma associated with it, but that is not the world in which we live. We have to be particularly attentive whenever data is being used to disclose this information about individuals. Now, the truth is that personal health information has always been gathered somewhere. So it might be gathered by our gossiping neighbor whenever we lived in villages, or it might be gathered by the town newspaper whenever that was kind of the dominant form of communication. So I don't want to pretend that this kind of information is brand new. It absolutely is not. Throughout human history, it's been gathered in different ways. The difference of what we're facing right now is the volume of data that's being gathered, the analytic capacity to use that new volume of data, and the ability to act on it from kind of institutional, organizational ways that largely was not present in the past. And so we are, I think, at a new moment in history when we need to be more reflective about the way these location data have implications for us about a very personal part of our lives. And again, this question of ethics, what ought we be doing? So in 1996, when we passed HIPAA, that was a normative claim as a society, as we passed this law saying, this is what we believe is right, that these entities ought to be regulated in a way that is different than other entities, and this information ought to be regulated in a way that is different from other information. We made that choice as a society as we enacted HIPAA. The question is, do we have a similar conversation that needs to be had now? Maybe not about all location data, but potentially about location data that leads to information about people's health. And so what is the nature of that data when it reveals something deeply personal about us? And do we need a new framework related to protected health information? Because I no longer need your electronic health record that's housed at the hospital where you get care to pretty readily predict some important things about your health behaviors or health status. That can be done by thousands of different companies right now that have data that's fairly readily accessible. So some big questions. Unfortunately, I don't have a lot of the answers, but I hope that this is part of a much broader conversation about the way that geography has very important implications for our health at the individual and population levels. Thank you.